Well, Diana Arroyo is the head of mission for the Doctors Without Borders team in Haiti. She joins us live now from Port-au-Prince. We very much appreciate your time here. Can you tell us then, firsthand, just how bad is the situation there now?
Thank you. Well, a series of threats by police forces against the staff of Doctors Without Borders, or MSF for its acronym in French, have unfortunately forced us to suspend our activities until further notice in the metropolitan area of Port-au-Prince, the capital of Haiti. And the incidents of this type started to increase since 2022. But in the past week, there was a significant deterioration of the security situation in which our teams work. This started on 11th November, specifically, when an MSF ambulance carrying 3 young people with gunshot wounds was stopped by the police. And after an attempted arrest and shots were fired in the air, the police escorted the ambulance to a public hospital where law enforcement officers and members of a self-defense group surrounded the ambulance, slashed the tires, tear gassed the MSF staff inside the vehicle to force them out, and then they took the patients out and executed at least 2 of them. Since then, we have not received responses from authorities regarding that incident, and instead, in only 1 week, MSF has faced 4 more incidents in which police officers have stopped MSF vehicles multiple times and directly threatened MSF staff members, including death threats and rape threats. So this has left us with no choice but to suspend our activities in Port-au-Prince as of tomorrow.
It must be a very difficult, heart-wrenching decision to halt activities, though, when you know how desperately people need the help that you provide.
Certainly. We have been in Haiti for more than 30 years, and this decision, as you say, we take it with a very heavy heart, because healthcare services have never been so limited for the population as they are now. Many people will lose access to our services because we are not able to work safely, because our staff is terrified. Each week, on average, in Port-au-Prince, MSF provides care to more than 1,100 patients on an outpatient basis, 54 children with emergency conditions, and more than 80 survivors of sexual and gender-based violence. We remain committed to the population in Haiti, but cannot resume activities as usual unless we are guaranteed unhindered security and respect for our medical and humanitarian mandate by law enforcement officers.
Given what you say then, what would be needed in terms of security to allow you to resume activities in Haiti? What are you actually calling for?
So today we sent a letter to the Transitional Presidential Council, to different entities within the National Haitian Police, the Multinational Security Support Mission, the Prime Minister, and a number of relevant ministries. Therein, we specified that to be able to resume activities, we ask for a firm and prompt commitment to ensure that our teams can carry out their work safely. And now I want to be clear that we are not asking for physical armed protection, because our security has always been based and should continue to be based on both acceptance by the population and also based on the respect from all actors present in Haiti, including the national police. We stand ready to discuss the conditions for resuming our activities, including an official communication transmitted to all ranks of the national police, calling for the respect of our work and recalling that no obstacles and no attacks on MSF staff, patients, or structures can be tolerated. We are also requesting public communication from authorities in support of MSF, condemning the acts and calling for the respect of our medical activities.
OK, Diana Arroyo, head of mission for Doctors Without Borders in Haiti, thank you very much indeed for joining us.